Hello, my name is Autumn and I'm a senior McNair Scholar at the University of Oregon. My research is titled Using Breathing-Based Meditation to Decrease Stress and Improve Dyspnea in Individuals with COPD. I received guidance from my McNair mentor, Dr. Samantha Schoon, and this project was conducted through the Optimizing Swallowing and Eating for the Elderly lab here at the University of Oregon. So before we dive into the research, I want to go over just a few terms. The first is COPD, which stands for Chronic Obstructive Pulmonary Disease. This disease is progressive, which means it worsens over time, and characteristics include breathing problems such as dyspnea and excessive coughing. So next is dyspnea, which is the term used to describe difficult or labored breathing. This is the breathlessness that's often associated with COPD. Next is dysphagia, which refers to swallowing disorders. And last we have SKY, which is the acronym for Sudarshan Kriya Yoga. This is a controlled cyclical meditative breathing practice that has been shown to provide relief from various ailments. So as a reminder, the disease of COPD is progressive, life-threatening, and common symptoms include dyspnea and excessive coughing. Prior to COVID, COPD was the third leading cause of death in the U.S. And not only is it one of the leading causes of death in the U.S., but it has a large impact on quality of life for those afflicted. Both COPD and dysphagia impact an individual's anxiety and overall perceived stress levels. Additionally, it's not uncommon for the two to co-occur. The reason for this is that the disruption in the ventilation pattern in persons with COPD can have the additional effect of disrupting their swallowing function. The common symptoms of dyspnea, coughing, and a high choking risk often lead those with symptoms to lessen or cease various activities of daily living, such as going out to eat, socializing, being physically active, etc. So finding ways to decrease the severity of these symptoms is beneficial for the quality and longevity of life for those with COPD and or dysphagia. So now let's talk about meditation as treatment. Meditation has been researched and been found to be successful at controlling a number of different conditions: arthritis, fibromyalgia, and chronic pain, to name just a few. For this study, we chose to use SKY meditation. SKY meditation, as a reminder, is a controlled cyclical breathing practice, and it has been shown to provide relief for depression among other mental conditions. SKY consists of 5 distinct breathing techniques that you can see listed here on my poster. Those are victorious breath, bellows breath, chanting Om 3 times, Sudarshan Kriya, and Yoga Nidra. So now let's talk about the purpose of this study. Why even study how SKY meditation impacts those with COPD? Well, to begin with, there's no prior research using breathing-based meditation on the COPD population. This means that I really had the opportunity with this study to bridge that knowledge gap. Additionally, this is a population with a condition that is irreversible and progressive. That means that finding ways to improve overall quality of life for them is key. One way to do this is by lowering stress and anxiety levels, and in doing so, to see if this decreased stress actually results in a measurable difference in not only their overall outlook, but also the severity of their symptoms, specifically the dyspnea and dysphagia. So now let's talk about the research questions. So this study aimed to answer 2 research questions. The first is, will participation in a SKY meditation program decrease perceived stress and anxiety? And second, if the above is true, will this improve severity and or occurrences of symptoms, specifically the dyspnea and dysphagia? So now let's talk about the methods. Participants were gathered for this study by word of mouth, online digital flyers, as well as physical flyers in physicians' offices. We initially enlisted 16 participants, but only ended up with a total of 9 that completed the study all the way through. Participants needed to have a documented COPD diagnosis. They needed to be 75 or younger, fluent in English, and they needed to have a good internet connection with a suitable device for Zoom, as well as appropriate cognitive linguistic skills that would allow them to follow directions and ask questions along the way as necessary. The actual SKY intervention program was administered through Zoom, with participants having been split into 3 groups, and all 3 groups completed their interventions within the same month. The individual who conducted the intervention was an approved instructor through the Art of Living SKY Committee, and we used a phenomenological qualitative methodology for this research project. This included qualitative data collection from single case open-ended interviews that ranged from 30 to 45 minutes for each participant. So now let's talk about the results. Several themes in personal experience across participants emerged from the data, and I've broken them down here into 3 categories. First is mind. So participants experienced mind benefits such as feeling overall more relaxed, more hopeful. They tended to have more mental energy, and they felt more connected to others socially. Second is body. In their bodies, participants experienced improved strength, endurance. They had more physical energy. The participants who experienced dysphagia also reported that their swallowing disorders became less severe. And last is breath. Participants reported breathing easier, deeper, and more controlled than prior to the SKY intervention. Many participants also reported significant improvement in their dyspnea. So I'd like to take a moment to read just a couple of participant quotes here. The first is, "When I take a deep breath, I get it now. Before, it just seemed like I was getting 3/4 of a breath in, but I can really feel it in my lungs now." And I think I'll read just one more. Another participant noted, "I have increased the resistance on the bike so that I'm getting a better workout. That's happened within the past week. I just feel like I can tolerate more." So that gives you just a little bit of an idea about some of the things that participants noted in their interviews. So what does this all mean? Participants reported experiencing decreased levels of perceived stress and anxiety, as well as a decrease in severity and occurrence of their dyspnea and their dysphagia. So the physiological and psychological improvements that were noted widely across participants included improved sleep. This is both in quality and duration. Next were greater feelings of social connection. The third was improved energy and physical activity. And the fourth was improved emotional regulation. This indicates that stress and anxiety are heavily tied into physiological symptoms in persons with COPD, and that SKY meditation is one method to break the feedback loop leading to symptom exacerbation and decreased quality of life. Although our participant pool was pretty small, I do believe additional studies with larger or broader participant pools would be recommended here. And that is my poster. Thanks so much for listening. And I do want to extend a big thank you to Dr. Samantha Schoon, Dr. Ting-Fin Lin, Dr. Christabel Dragoo, and Denise Elder for helping me along the way with this research project, as well as a big thank you to the OC Lab more broadly, as well as the McNair Scholars Program. Thank you so much for the opportunity.